Hello and good morning. Thank you so much for watching Church of Uganda Family TV. My name is Robert Mohammed here with issues at hand. Today we have a very interesting topic and we're going to be dissecting self-care and adolescent health. I'm not alone in studios. I'll be joined by Mr. Semakula Henry from the Ministry of Education and Sports, who will be taking us through the different topics under self-care and adolescent health. Thank you so much for coming through, sir.
Very much welcome.
All right, let's take a deep dive into our topic today. What is self-care and adolescent health?
Good morning, our dear viewers and listeners. As rightly said, my name is Semakula Henry and I work with the Ministry of Education and Sports. I am substantively based in the Department of University Education and Training, but I have many other cross-cutting roles. One that connects to my being here is that I'm the assistant coordinator on matters of school health. And when you're handling matters of school health, around with other sectors, for example, the Ministry of Health and Ministry of Gender. And so I'm glad to be here with a colleague from the Ministry of Health to discuss these issues. You've asked a very important question. First of all, you've informed our viewers that we are going to discuss adolescent health and particularly issues of self-care.
Yeah.
So you began by asking self-care, and I will briefly say that self-care is about minding about your own health, because many times when we are unhealthy, we tend to think the doctor should come, the nurse should come, the Musa of any sort should come, the counselor should come. But there's a lot that an individual can do on their own to ensure that they are healthy. And I'm just reminding people that among the many issues to do with how you eat, how you manage your life, do you do exercise, how you manage your emotions when you are emotional, when you are stressed, how do you support yourself before going to seek for other people's indulgence? How about the eating habits, the nutrition habits and all that? I think that is all part of really what we call the doctor will dissect it more from the medical angle, but from a point of view, that's the quick brief I could give.
All right, thank you so much for that brief overview. Now you've talked about school health. And before we dive into school health, our listeners out there would want to know, like, the adolescent group, like which age bracket are we talking about?
Okay, when we talk of adolescence, this is the period when young people are actually transiting into adulthood. Ideally, it is the time when the teen age starts. Okay, the teen age starts at 13, but adolescence begins from 10 up to 19, according to the classification of World Health Organization. And these are people who are into their prime of life, who have just been so young. They are going through a number of changes, including emotional, including cognitive, including physical, including social. They are very excited about growing and wanting to be independent, and they are doing a lot of exploration of what is taking place around them. It is a period of uncertainty, though, because these young people are bombarded with a huge arena of things in this world, and sometimes they actually end up making wrong choices because they are very excited. And among the key issues that really challenge them around this period of life are health issues, which we shall explain in detail when you ask. Otherwise, when you ask about adolescence, it is ideally 10 to 19 years. And maybe I should also quickly explain that at that very time, since they are uncertain, they have so many questions. And sometimes they are not able to come out themselves to ask the questions. So we, the adults, must support them in finding answers to those so many challenging questions that they have at that period.
Well, thank you so much for that. Now, allow me ask you this, considering you're in those spaces, the education spaces, you get to interact a lot with these adolescents. So would you kindly share with us the key issues, like the challenges they mainly face? You know, you've talked about they be so desperate to try new things, they don't know a lot, so those who don't get help, those who don't get guidance from elders, which challenges do they face?
Okay, just a quick repeat that the challenges are really wide, ranging from social to through economic, through even religious, through psychological changes, but also most importantly, biological changes. And these biological changes happen to every human being. Only that when they happen, some people are challenged to cope with some new biological change really coming up to them. So if we got to deep dive into the issues, the key issues currently are really so many, and I'll not go specific social or psychological, but I'll just bundle it up. One of the key challenges happening right about now is mental health challenges. We see many of our young people getting stressed, getting emotional, getting depressed, others even getting into trauma because of several reasons. Among the reasons, sometimes it is pressures from home. Some homes are so toxic. Some families are dysfunctional. They are there, but father and mother are not really in. They are absentee parents. The children are getting a lot of pressure from the colleagues around them, demanding this and that, trying to live a very high life. Economic issues. They are young, yes, but they have certain issues. They want a phone, they have to dress well. So all that really puts pressure on them. And so there are really issues. Sometimes it is unfortunate that even when they're at school, there are some pressures there that really put them off. We, for example, have heard of a few institutions where the pressure is too much into academics, no space for resting, no space for prayer, no space for meditation. Everybody thinking of getting super fast grade. So it is class time all the time. It is examination from morning to evening, beginning of term, mid-term, end of term. So all those are pressures. But also sometimes the pressures coming in regarding their performance, either from the teachers or the parents. You see, we parents are also funny. We want a super fast grade. We want a 4 at P7. We want good grades at senior 4 and A level. We want somebody to go to university and go for the best course. Yes, we wish them well, but the pressure shouldn't be so much to really push them to the wall. And because of the many mental health challenges, we've seen a number of suicides, for example, happening among young people, taking their lives. There's an unfortunate case where a young girl from Mukono, I think this was so much of a media, really took her life because of a decision by the parents to change her from one school to another. This is a girl who had a boyfriend, according to the papers, and so she felt missing the boyfriend, and that alone took her life. But we've heard of young people just taking their life. Again, academic pressures, as I said. There's one who took her life because of a combination. The parents wanted a different combination. She thought she would also manage a different one. So the pressure became so much on her, she took her life. But we've also had challenges coming in from drug abuse. There's a lot of drug abuse, drug and substance abuse and use out there. And so our young people are tempted to get in there without knowing the consequences. Whereas sometimes they get into drug abuse with the assumption that it is going to solve their emotional problems. They actually end up wearing off as their talk is locking in. And so they end up really emotionally miswired. And that's why we see a number of them actually getting to levels of going to mental health facilities. If you moved into Butabika Hospital, I'm sure you'll be surprised to find that majority of the people there are people within the ages of 15 to around 30. And this is the same phase of life that also has our adolescents. So they've been tempted into some of these drugs, very many of them. The drugs are also very accessible out there. The drugs are cheap, they can easily be gotten. These people begin by making fun as they taste the cigarette, but they end up addicted. It comes with a cost. These drugs are very expensive. So the young people will now in the end up again committing crime because they want to fit in and continue taking their drugs. And we've seen quite a number of them dropping out of school, actually losing a sense of understanding of their life. And many of them have even become impaired in some way, including emotional impairment. People out there prefer calling it madness, but I think in psychological terms, the doctor will tell us more. It is not really madness, but it is mental illness. And indeed, this is part of what has brought trouble. But we also have the challenge of teenage pregnancy among our young people. It is a very, very huge challenge. Before the lockdown, we had these many cases. But when the lockdown came in and all the challenges it came with, the children are not at school, not getting information, the children are not accessing adolescent health centers to get more support. They were at home, some of them mixed up with people who were relatives, but bad relatives. That's why among the teenage pregnancies, you'll even hear that there are those that resulted from incest. This challenge of teenage pregnancy is so huge in some regions of Uganda. For example, Busoga, Karamoja, West Nile, although even other regions have this challenge. And it comes along with many other troubles. When they get pregnant when they are teenagers, chances of fistula are high. Hope you know what fistula is. Chances of prematures is also possible, delivering children who are not yet ready. Chances of poverty, permanent poverty, because when you get pregnant when you're a teenager, and then chances of continuing in school are not there, then it is also likely that you'll end up unskilled. And if you are unskilled, then the world is really going to be troublesome for you. Some of them have been disowned by their families and parents, leave alone the burden of looking after a child when you're also a child. So that is also another issue. The other issue is about early marriages, quite a lot around the different regions, including the ones I've mentioned. Sometimes it is the parents who are a bit irresponsible. Sometimes it is culture to blame. There are some of these culture activities that take place. I don't want to mention them over TV, but we know many culture activities that come along with certain practices. For example, where young people have to really be in one place and dance all the night. We've heard of weird dances in some regions. Somebody dies and then in the night it's almost a celebration. Something to do with disco matanga, for example, common in eastern Uganda, around districts of Namaingo and Bujiri and Busia. So all those are really areas that really take them into trouble. But also the issue of violence. There's a lot of violence befalling our children. Unfortunately, sometimes the violence comes from our homes, the parents, it comes from relatives. It is also sad that sometimes the violence comes from community leaders. Sometimes more sadly, it even comes from religious leaders or people concocting or pretending to be. And many other people who are supposed to be defense lines of our young people end up really affecting them. And when you go talking about violence, then there's quite a lot. It could be physical, could be emotional, could be psychological. In the physical, we've had adolescents being beaten up, being caned, being hit, having their heads knocked. We've had many of them complain about just psychological abuse, like common insult. When you abuse your daughter of 14, that you are so ugly, you are the mother, but you are telling the daughter you're so ugly. Instead of producing you, I would have produced a jackfruit, would have eaten it already. Now, that can be so more social and emotionally impactful than even a physical punishment. So we have all that. We have bullying happening. We have stigma and discrimination happening among our young people. You people in such places know that, for example, there's a lot of body shaming going on, especially in social media. As a counselor, I've had a number of young people coming just for counseling in that area. These are all forms of online abuse, defaming, just making inflammatory remarks over somebody. The school strikes are also a challenge. Some of them are influenced in there. The demonstrations. These adolescents are easily influenced because for them, they are eager to explore. When you say, hey, we go, they can always go without even knowing what they are going to do and where they are actually going. But the issue of adolescents living with special needs is also a common challenge. Sometimes people want to call these disabilities, those who are lame, those who have hearing impairment, or even viewing impairment. They also have quite a number of challenges. And indeed, theirs are normally double challenges, because if a girl with a disability now gets pregnant, the challenges of also accessing care are very high. The challenge of the boy or the man denying the pregnancy is also very high. So all those are really issues around them. The list can be very long, but if you may just allow me conclude for now with a few. We've also had the challenge of hysteria, where our young people just suddenly pretend to be sick when they're actually not. Well, they could be emotionally sick, but not much of a deal. We had, for example, a secondary school, girls' secondary school one time, where every girl for about 3 days was walking lame, and many of them were shaking, and they were saying they are seeing demons at night, that they are hearing Bukalavand at night. But when we moved in to find what the challenge was, they just had small issues. They are saying the pressures from the school were too high, no breathing space, academics all the time. There had not been a visitation for some time. Some girls openly told us that, you see, we are even missing our boyfriends. Now, whereas we parents expect they're at school, they are concentrating, but there's also that bit. And so all these issues really come up and challenge them. Nutrition, they want to make figure. Have you had girls trying to make campus figure, for example, in that A level?
Yeah, sure.
And so they refuse to eat. And there are challenges. I know the doctor will explain more about the challenges to do with poor eating habits, because it also impacts finally on performance and on other physical activities, but also common challenges like malaria, the cough, the flu. For us as an education sector, over the last 4 or 5 years, we've suffered through COVID itself, but also conjunctivitis, that is something to do with the eyes, mpox. All those diseases that really limit interaction are really a key challenge where adolescents meet. And indeed, many other challenges that our young people are going through. Maybe to wind it up, sometimes we think it is only these very young who are adolescents. But for us as ministry, we've also noted that beyond adolescence, those young adults at university also have very similar challenges. And many times we ignore them thinking they are grown. Kumbe?
They also need polishing and all that.
Please.
Thank you so much for listing the challenges. In case you've just joined us, thank you so much. We are discussing self-care and adolescent health. And with me in studios is Mr. Semakula Henry from the Ministry of Education and Sports. Now, when I was within this age bracket back then, they used to call us the leaders of tomorrow. So you've listed the challenges, and it's from here I'm going to ask you, are there initiatives you as a ministry have put in place to help our leaders of tomorrow?
Yes, that is very, very true. You are answering the very question. The Ministry of Education and Sports cannot keep quiet over adolescent challenges. Reason being, we have the highest number of these adolescents as school-going. And for the bigger part of the year, the school-going adolescents are actually at school. And if you know about the length of the school term, it's about 90 days. 90 times 3 makes 270. 270 out of 365 means that these young people are in our hands in the schools for over 2/3 of the year. So we are definitely duty-bound to support them and attend to them. And so there are quite a number of things we've done, and not only us as ministry, but government generally, because we also do some of the things in a multi-sectoral manner. I mentioned earlier that we work a lot with Minister of Gender and with Minister of Health. So to begin with, we have a multi-sectoral arrangement where we actually have multi-sectoral meetings to come together and say, what do we see happening to adolescents outside school? Minister of Gender will give the highlights. What do we see happening to adolescents in school? Minister of Education will come in. But Minister of Health now will also come in to tell us what do they see in the health facilities, which are the issues overreported, what is being done. So that multi-sector arrangement is one big thing that we are doing. But two, as a ministry, we've also developed a number of policy guidelines and other frameworks and guidelines to support issues of providing school health. You must have heard of, for example, a guideline to do with the re-entry of teenage mothers and prevention of teenage pregnancy. This is a guideline that has not been in existence for some time, not until the issue of teenage mothers became so big. And we realize that when they become teenage mothers, we don't really need to push them away from school. They can always be in and be supported, but they should not come with their babies. So the guideline explains how long they should stay away and which are the processes of returning, and so on and so forth. There's also a guideline for schools to manage guidance and counseling. It should be a deliberate program for every school to ensure there's that moment when the children are guided and counseled. There's a guideline on formation of school clubs, and this helps the schools where a teacher cannot be, at least members of a club can stand in for the others. There's a guideline to do with menstrual hygiene management. This is a key challenge. This is a God-given thing. It is natural for girls to menstruate, and it is natural for all women. But our young people, especially the adolescents, are sometimes challenged when they reach this moment, when they're not prepared, when they don't have enough information about how to be supported, when they don't get good support from schools and parents. And so we've set out a guideline to help schools and these girls themselves. But we've also recently sent out a guideline on mental health. Having realized that some of the challenges are school-based, we've told the schools what they can do in order to. We as a ministry have a full department in charge of guidance and counseling, and another unit in charge of gender issues, and the unit directly in charge of school health, and these are all meant to be part of the support. As I talk now, we are reviewing the sexuality education framework, and we are working together with key stakeholders, including the church. And now that I'm on a church TV, I should also appreciate that. We really appreciate the religious leaders that have come in to guide us on how we can agree on a framework that will work for the whole country. I can always say more and more as we move on.
Oh, thank you so much, Mr. Semakula. Allow me dive in for a small commercial break, but we'll return with the discussion. Do stay on Church of Uganda Family TV.
Issues at hand. Issues at hand.
Welcome back from the small break. We are still continuing with our discussion, and remember we are discussing self-care and adolescent health. With me today is Mr. Semakula Henry from the Ministry of Education and Sports. Before we went in for the break, he was telling us the different initiatives that are being put in place by the ministry to help and curb these challenges and help the leaders of tomorrow. So we are still continuing, and allow me ask you, sir, how should the public come in? Because you've listed the initiatives you guys have in place to help these young people, but is there a way you want even the public to come in and be of assistance?
Thank you very much, Robert. Indeed, public support is very, very critical. We must accept that the adolescents don't live in their own space. They live within community, starting from home. They start from a family. They stay in a village. They stay in a sub-parish if it's a church context. They stay within reach of other peers, fellow adolescents. There are so many adolescent organizations out there, young people organizations of different sorts, associations of different sorts, covering different aspects of life. We call upon them beyond whatever they are doing, because for us, for example, as Minister of Education, we believe that one of the things young people can get information from is school clubs. But we know that beyond school, even in the communities there are such clubs and associations. And so beyond simply having life and enjoying life and dancing and eating, they should also remind themselves, and this focuses on what we actually mean by self-care, they should also remind themselves that as young people, there's a lot they can do. The parents in particular, these are our children. We are the first teachers. We understand our children more and more than we understand other children. So we know their weaknesses, we know one who gets annoyed so easily, we know who can easily be influenced, we know who gets happy over small things, we know who could even simply slip into alcohol and drug abuse. So it should be us to start with. And then the community. Young people are normally tired of our talk with the old people that this and this didn't happen in our times. But yes, our times were different, but in our times, the entire community was responsible for the development and growth of a child. So even along the way, if you misbehaved, an elder would come and put you to order. But of course, that doesn't happen much today. But that is not to mean that that was bad. So I want to call upon community members. Please try to do your part. Talk to this child who is misbehaving, who is going in for a wrong dance, who is dressing indecently, who is speaking obscenity, and do your part. Of course, in the communities, there are many other people, many other elders, and so on. Please do your part so that all together we can end up changing the lives of these young people. I mentioned earlier that as ministry, we don't mind the adolescents alone. We work with other sectors. One of the key sectors is Ministry of Gender. And I know that the Ministry of Gender has many structures out there, youth organizations, children organizations, women organizations. The church also has its own organizations, the fathers' unions, the mothers' unions. All these can really take up the role of ensuring that young people's health is put into concern, and they create space to really talk to them. Back at the school, we have people we call the senior women and senior men, and these are meant to help the young people attend to. They are meant to help attend to the day-to-day challenges of young people. I am a girl. I've just gotten into menstruation, and I'm confused what to do. The first key point is the senior woman. But you also have people we call the in-charges of guidance and counseling to generally handle those psychosocial challenges of the young people. Similarly, in the communities, these structures should be existing. The elderly women, the nurses around, the social workers, let us not only mind what we do at our place of work, but also mind the life of the young people that are within us. You, the media, have a very, very huge role, because young people don't even want to read so much these days. They are onto media. and specifically they are more onto social media. You can very, very easily reach out to them through your TikTok, through the YouTube, through whatever, because they are there. And they are not interested in this too much writing of a book. So they want those quick things that really relate with them. They are over on TV, they are over on radio, they are over on phone. And so you can really do a lot of work in delivering information to them. But we also know that the health facilities out there should also mind the health of these young people by creating safe space for them. What do we mean by safe space? Sometimes the word safe space is also misunderstood to mean that maybe this is where now they go into all those unwanted habits. I think the original intention was that they come into a space where they are free to express themselves. Somebody has an STI and he can freely talk to a person who will listen without judging them. Because that is one other challenge the young people have. If they have been violated and they report to someone and then it gets viral and everybody has to get the information, so such facilities should be confidential enough, and the young people should be assured that what they have come to express will not again simply go public. We also prefer that services in such facilities should be available for the times the young people also have time. Because, for example, the young people are mainly at school. Maybe their free hours are after school, possibly from 5 onwards. And that could then mean that if you organize a facility, it should be that facility that is able to attend to them within that time. Then how about the people who are giving them the service? These should be type of people that really match with their age. Not that for us, the matures, we don't know, but they will feel more safe.
Sharing with their
and
peers.
I know that Dr. Grace will speak more to that context of issues related to how the young people should be served. Otherwise, just to conclude, for now, is that we also need the support of religious leaders, and we badly do, because religious leaders have a huge voice. Their voice is heard and respected. They have access to everybody all the time. On Sunday, we fill up the churches. Anytime we are invited for prayer, we are up there. I personally believe that church leaders are very, very knowledgeable in so many things. Some people think they're only knowledgeable in spiritual matters. I'm a Catholic, for example, and I'm a friend to so many Catholic priests. And I've not had a friend who reads and researches like my Catholic priests. They research on anything, IT, whichever, adolescent, whatever they have time, because they must understand the situation before they actually take it out there. So we need the voices of religious leaders. We need them because people listen to them, people trust them, they are available, they are convincing. Once you tell a young person about character when you're a religious leader, they feel like it is coming from God. These are people who have been tried and tested and proved to be good in what they do.
Well, thank you so much, Mr. Semakula Henry. We are still continuing with the discussion, and it's about self-care and adolescent health. Now we are joined by Dr. Ruth Grace from the Ministry of Health. Thank you for coming through, Doctor. Earlier on, we've had an extensive discussion with Mr. Semakula, and allow me to take it from here and ask you, like, the Ministry of Health, in as far as our topic is concerned, have you put in place initiatives to tackle this challenge of mental health? Because he has mainly handled the social parts of the school, the communities, the church. So as Ministry of Health, you also have initiatives put in place to curb some of the challenges under adolescent health?
Okay, thank you very much. I will first of all introduce myself. My name is Dr. Ruth Grace Babidie Kakoba. I'm an obstetrician by training, but here on behalf of the Department of Reproductive and Child Health, Self-Care Family Planning Team. The reason that we are here today and the question that you've asked is very interesting. Someone may also ask, what is self-care anyway? I know my colleague has tried to go deep dive into it. Well, and just to make it simple from where he took it from is, it is basically what do you do about your body, your own well-being, not just going to hospital for injections or for drugs. But before you get there, what else do you do? And that, of course, includes mental health and more aspects. The Ministry of Health has put into different mechanisms that we indeed help people. First of all, having free healthcare is the number one thing. Uganda is the only country that offers free healthcare and people are able to actually access care. That is something that we downplay, but most times is like the greatest thing that we have as a country. There may be some challenges here and there, but the truth is that at least if you went into a government hospital right now, you'll be able to at least get a primary healthcare service. Now, a primary healthcare service is one that you get not because you're sick. It's a checkup. These days in private clinics, we call them the wellness checks. So that is a self-care check, I would say. And aside that is in regards to adolescent health, we've tried to make guidelines for young people to be able to access care. And how we have done this is by putting in place mechanisms where health workers are taught, including the teachers at schools are taught. We work together with the Ministry of Education and Sports and teach teachers and also teach the students within school that you are allowed to go into the facility. When it comes to adolescent health, there's always challenges with access to healthcare, and the question is why don't they access the hospitals? And majority of them will tell us that the healthcare facilities are actually a barrier. I see the facility, it is in front of me, but I cannot access it, I cannot enter it because there's an invisible barrier. Someone feels when I come into a facility, I am going to be next to my father or my mother when I'm getting care. Yeah. So how do we solve that? And indeed, in the new structures under the Ministry of Health, we've tried to put a separate area where young people can actually go for these healthcare services. We've tried to split what we call the outpatient departments, OPD. Most times you'll hear the word OPD when you go to facilities. We've tried to split them so that you don't have the same young person coming to consult about an STI being in the same line with a parent or a relative of theirs. And I think that is very helpful. In places where the constructions have not happened, we've tried to set up what they call adolescent corners, especially for regional referral hospitals. These are places where young people, some of them are saying, these days we go to hospitals to play. It is okay. First of all, adolescents are children. They're below the age of 18. They're allowed to play, and play is part of growth. So we invite young people to come and play. Come and play your Matatu, come and play your Ludo, but you're in a place where you can get your healthcare service. As you're playing that Ludo, you're also asking a healthcare provider, oh, by the way, what can I do? If you're a young man and you're asking your healthcare provider, what can I do? I have this girl that I really love so much. Then a healthcare provider is able to tell you, are you ready for other responsibilities in case you say, fine, you love her and you want to go ahead and you're already actually engaged in any sexual activities. We most times deny the fact that that young people are actually sexually engaged. Those who are sexually engaged, we need to work with how do we talk to them. And those who are not yet sexually engaged, the internet is like a very open place. So we need to work with the times that are changing. And I think the Ministry of Health has tried to do that, put out messages to young people through the different partners that we work with and tell them, yes, please, abstinence is still okay. It is still a normal thing, and I hope young people out there can also know that self-care, loving your own body and saying no to sex is also one of the things that you can do to prevent a pregnancy that is unintended. Teenage pregnancies still kill up to 24% of our mothers in Uganda. So you can imagine a young population of over 50% of people in Uganda are young people. That is below the age of 24 years. So teenagers contribute up to 23% of the deaths. So you can imagine maternal deaths. Why are we having all these numbers? And self-care, it being holistic, we go beyond just the individual that comes to us. We also go to the family, the community around them. And by mandate, the health facilities within the different districts from health center 2s and 3s, we have outreaches that we do. Now, these outreaches is where the health workers come away from the facility and they get into the community to talk to people about different matters of health. In those outreaches, we also carry out immunizations for young children because there's also the babies who need their self-care. The best person to provide the self-care for the babies is the parent. So we reach out to them and are able to talk to the parents about catch-up for nutrition growth, catch-up for any vaccinations that have been lost. And I think you have seen that recently the Permanent Secretary did launch the CHOOSE. I don't know if you've heard about them. The Community Health Educated Worker workers. These are more like VHTs, but then they are a little bit higher than the VHTs because for them they are paid and educated. Now, these are also healthcare providers that are within our community. So that when you're sleeping in your house, right now in Kampala, I don't know if you stay in Kampala or Wakiso, but if you're in your home, you're less likely to even hear what a neighbor is saying. You're less likely to reach out for your neighbor for help. The question is why? So now we have to help people. VHTs come in to bridge that part within families. VHTs come and then knock on your door, say, hello, are you okay? Now, all that is part of self-care. And I wouldn't be just to the department if I left without saying that Self-Care Month is next month. And this month we are teaching about birth asphyxia. Now, birth asphyxia is a time when a baby is not able to have their first cry at birth. Now, the little babies need champions. And their champions are us. Not us women, but us as everyone as a collective. Women and men, when we engage in sexual activities and then we say we are going to go ahead and have this pregnancy, we need to know that there is a baby that is growing and needs to be taken care of. Majority of our babies that fail to breathe or even have their first cry are due to teenage pregnancies because their bodies are not yet fully developed to push out a fully grown baby. So when that baby is coming out, the baby gets tired. The baby now fails to breathe. And the consequences of that, I think I don't know if we know about them, but we can see that children who have cerebral palsy, children who have delays in studying, delays in even just getting to their milestones like sitting or walking, a child is just delayed. Those are babies that could have suffered birth asphyxia. So indeed this month we are celebrating that as it launches us into the Self-Care Awareness Month next month. Thank you.
All right, thank you so much, Dr. Ruth Grace. Now, you've talked about the outreach programs you have as a ministry. Now the people at the forefront, are they young people, or it goes back to what he said, like these guys or the adolescents we are talking about feel more safe to share with their peers?
Yes.
If they may see someone like Mr. Henry and they'll be like, no, that's more my dad, they won't share with him.
That is too much.
The people you have at the forefront, are they like young people or?
So it is both, because the young people also have to be guided. So what we do is that we usually get what they call peer educators. They come in and then we teach them a few things in regards to their sexual reproductive health. What do they want to know? And sexual reproductive health goes beyond just sexual involvement. It's about personal hygiene, menstrual health management, personal care. How do you flaunt yourself as a lady? How do you flaunt yourself as a man? And also keeping someone with life skills. So all those they get as a package, and then they become peers within their communities and also their schools for those who are school going. And then sometimes you supervise, especially if it's the first time, because you need to know what are they talking about. Especially if you have a group of young people that are coming together. You don't want to be in a situation where you're having alcohol being brought into a facility and then we say it is a youth corner and people are engaging. But at least there's been a lot of respect. Our peer educators are very mindful of that, and they actually teach others more on what to do. Yes.
All right. The last one, Doctor, are these only for like urban centered populations, or you have plans for even the hard to reach areas?
The hard to reach areas are already involved. I would like to tell everyone that we actually reach everyone up to the border. We work with different partners who are supporting us, including refugee communities. And if you're out there and you don't have access to these services, please reach out to us. We shall be able to help. This is not only for urban, we also have for all the districts. It is the mandate of the district health officers to provide this care, and assistant district health officers of health are able to support the mothers, support the community, support these young people in access to care. Thank you.
Well, thank you so much, Doctor, and thank you so much, Mr. Henry. Could you please say your parting shots as we conclude?
Okay, my parting shot. Thank you so much, Family TV, for this engagement. Thank you very much, Dr. Ruth, for coming by. I was worried you would not come. And so it was a voice coming in from one side. She rightly talks of young people being handled by people of close to their age. But it's very important that they are handled by professionals and experts. So where there's need, certainly the elderly will come in, but even those who are a little elderly have been guided on how to handle these young people. She also mentioned something to do with life skills, and this is one key thing we do at Ministry of Education, because we may not provide medicine and any other support. For us, we are too much into empowering this young person to know how to resist temptation, how to be creative over situations, how to negotiate, how to manage conflict, and at the end of the day, that will save them so much from all the challenges we've listed them. Ladies and gentlemen, we are very grateful for this moment. I want to thank Dr. Achola Roslyn at the Ministry of Health, who seems to be in charge of this self-care program. We are really on your side, and we are sure the sky is going to be the limit. Thank you.
So, Doctor, your parting shots.
Thank you very much. I would like to advise all the young people out there that your body is gold and guard it jealously. Make sure that you make your choices that are informed, and there's a bright future ahead of you. They did not lie. So take care of yourself and make sure that your self-care needs are met, and healthcare is always available. Whenever you need it, walk into the facility and ask for help. Thank you very much.
Well, thank you so much. For those who have been with us through the whole show, we appreciate you. Thank you for keeping it Church of Uganda Family TV. From me and the team, Issues at Hand, it's a good morning.
Issues at Hand.